And good morning. It is May 8, 2025. Dr. Duke Majan, CEO and founder of the Duke Spine Institute here. We're performing spine surgery on a patient's lower back who has chronic back pain since an accident. He also has symptoms in his legs. We're going to be going in and repairing 4 discs, L2-3, 3-4, 4-5, 5-1 on the right side. He's already had surgery on the left side. He was a staged surgery. Staged means you break the surgery up into 2 or more surgeries because you can't do it all in one surgery. In the world of spine surgery, staged surgeries exist. In the world of surgery, staged surgeries exist. It doesn't matter what surgical field you're in. A lot of times patients have to have surgery done in 2 different stages. He's a little light. So this patient, we did 2 days ago, his left side. Make sure when you guys are taking him off the table, you guys just log roll him, okay, carefully so we don't re-herniate him. He's had injury to 4 discs on both sides with nerve root compression and irritation on both sides. Now, he's got a very deep back. We know that from Tuesday. We're going to use our long needles. Let me know when I can start. Yes, no, maybe so. Injection. Shot. Probably need to be a little bit lower. If you have questions, feel free to ask me. I'm happy to answer your questions for you if I can. I am operating, but at the same time, I usually can answer questions while I operate. That looks much better. Let's do some num-num. So why do we apply numbing medicine as we pass from the skin down to the spine? The answer is there are specific pain structures in every part of your body. Not everything in your body can cause pain. So pain only comes from very specific things, and as a surgeon, it's your job to know what causes pain. The skin, definitely. If you cut the skin, it hurts. Shut. Muscle, generally not, but fascia, which is the covering over the muscle, yes. Fascia should be numbed up so that patients don't have fascia pain. All right, Sean. Henry, I think it would be helpful to show our audience, AP, the 30 different things that cause back pain.
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. As you can see, shot from our video, that there are about 30 different causes to back pain. This patient had 4 discs causing his back pain and also leg symptoms. That's what we're fixing today. We're fixing the right side. Earlier this week we did the left side. John? And the other problem he has is a piriformis syndrome, which is a torn muscle in the buttock. We talked about that this morning, he and I. And he decided he wants us to treat it, so we're going to be treating the piriformis as well. That way we don't have to bring him back and put him through another anesthesia. Sean? So, all right, so I had to do a little jockeying there with the needle at L4-5. L2-S1, we're right in the back of the disc like we were earlier this week, and at this point I have to get through a bone spur. And so I'll do that when he's asleep, more asleep and further along in the surgery. If you have questions, feel free to ask us. We're happy to take your questions during the surgery, and I'll do my best to answer them for you. Shot, any questions from the audience?
At this moment, no current questions.
All right. What I can tell you about this procedure is that it's virtually bloodless. There's a few drops of blood that will be lost in every case, but very little compared to open invasive surgery. Open surgery is highly invasive, and I spent the first many years of my career doing laminectomies and discectomies, fusions and artificial discs, stimulators, everything else in the spine. But in the last few years I've focused more on endoscopic, minimally invasive surgery because it's better for the patients. They want it, and it's safer, faster recovery, back to normal life very quickly. Keep hitting the top of the vertebral bodies that I'm trying to get into the disc. Any questions from our audience?
At this moment, no current questions.
All right, so we're right at the top of the bone, and I'm hitting the top of the vertebral body by literally 0.5 millimeter is all I need. So I'm going to have to pull back, and I'm going to have to redirect a little bit higher up, Sean. And I'm going to bend the needle a little bit, see if I can't use the bending of the needle just to get into the disc. It's a technique, a needle jockeying technique, Sean. So that way I don't have to come back out. All right, we got one more disc that needs access for us to do surgery. Any questions?
At this moment, no current questions.
Well, Henry, let's do this. Let's show the audience how is it that these disc injuries, like a herniated disc or bulging disc, how do they actually cause so much symptoms of pain in the back, pain in the legs, numbness, tingling, and weakness? How do they do it?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Thanks, Henry. You can see from the video animation shot that patients with injuries to their discs will get back pain through a process called inflammation. Sean? Now, inflammation is where your body uses a system that's you're born with called the inflammatory system to basically try to repair, destroy, and repair. It's the military of your body. It's your body's militia, all right? It is your body's defense system, your military system. It stays in your body, in your skin. It never leaves your body, though that would make a very cool movie, right? If you could send your inflammatory system out of your body to attack somebody or something. But basically, its purpose is to attack bacteria, fungus, even virally infected cells. It's a very primitive military system, all right? Shot? And it acts very primitively, meaning AP, meaning that it's not very specific. It just attacks whoever it thinks is the bad guy. And when your inflammatory system encounters, a bulging disc within the annular tear in the back of the disc, it sees that bulge as a foreign body. Why? Because that jelly called the nucleus pulposus has really been locked away inside the center of your disc, unexposed to your inflammatory system your whole life. Okay? So that jelly doesn't form until well before your inflammatory system develops, and your inflammatory system has never seen it before your entire life until it comes out through that tear in the back of the disc. And when it does, your inflammatory system says, hey, this is a foreigner. This shouldn't be here. It's attacking your body. Let's get rid of it. Sean? Yeah, I keep hitting the top of the vertebral bodies. And the inflammatory system basically attacks the herniation and tries to get rid of it. All right. Well, we've done it. I want to show you guys how much blood we've lost. Literally a few drops, and there was one more that had a few drops on it. But that's the blood loss for the whole surgery. If this patient had gone anywhere else in the world to fix those discs, they would get a fusion or artificial disc. It would be a major surgery, highly invasive, very dangerous, lots of bleeding, months and months of pain and painkillers. I'm going to do a very little minimal injection just because we've already treated the other side and I don't want to disrupt the healing on the other side 2 days ago. And that's it. All right. So any questions, feel free to ask. In the meantime, Henry, because our bodies cannot heal a herniated disc on their own, people need medical intervention or treatment to be able to heal those herniated discs. And most surgeons are taught to remove the disc, either remove the herniation that's sticking out or remove the disc. But there's another way, which is the Duke spine way, which is far more advanced than those primitive treatments. And what differentiates our treatment is that we cause no collateral damage to the body. All the other surgeries are invasive. They cause a big cut, cut through the fascia, peel the muscles off the spine, do damage to the muscles, damage to the fascia, damage to the ligaments, damage to the vertebrae and the lamina, facets, interspinous, supraspinous, ligamentum flavum. All those structures are damaged during the surgery by the surgeon in order to get down to the disc. With our surgery, we do zero collateral damage except to the skin. Shot? So the Duke laser disc repair already off the bat is much better because we're not causing any collateral damage. Collateral damage is what causes scar tissue and problems after surgery like complications. Thank you. Good thinking. Any questions?
Yes, we have a question coming from Michael on YouTube
All right, Michael, welcome to our stream.
saying, "Hi, Dr. Duke.
Hi.
Wishing you a great day of surgeries. If you have a collapsed disc, does that mean the tear runs the whole way around the disc?"
That's a great question. You can have a collapsed disc with just a tear in the back, but if your disc is completely collapsed, it's an indication of a big tear, usually a bigger tear than a small localized tear. It's called a broad-based tear. Good question. All right, I'm putting some numbing medicine because remember, we got to go through the fascia, which is outside the muscle, and that is a pain-sensitive structure, and I don't want the patient to be in pain. So I'm helping the patient and the anesthesiologist by injecting a little bit of numbing medicine just behind the spine. All right, then we go through the fascia and the muscle. We're not cutting any muscles right now, okay? To do this surgery, there's no cutting of any muscle, unlike open back surgery where muscles are cut. Have we shown the audience how the Duke laser disc repair repairs these discs?
Not yet.
All right, well, let's go ahead and do that. And notice during the surgery, it's a small incision. The rest of the body is left intact. There is no damage to your body. And right now, you may say, well, aren't you doing some damage right now? You're pounding that metal stake into his disc. The answer is the metal stake is going through his herniation. So we're actually pushing the herniation back into the disc right now, and then I'm going to go inside and take it out. And it's called the inside-out technique. It is one of the two techniques used to endoscopic transforaminal removal of herniation, inside out and outside in. Outside in is not a technique I use. I've been trained on it, but I do not like it. It is not as safe for the patient as inside out. Inside out is the technique of transforaminal endoscopic surgery that was popularized by Dr. Anthony Young. Measure. Take a look here. We got a small incision. It's about a centimeter, okay? And this entire surgery will be done through a metal tube that literally is 7 millimeters wide. And that's the beauty of this minimally invasive treatment. It's not available anywhere else in the world that I'm aware of. Now, other doctors, we've been broadcasting these same surgeries for 11 years. So there are probably other doctors now that are starting to copy our surgical technique, and that's fine. I'm happy they are. But at the same time, I can't vouch for their technique because I didn't personally train them. So if you want the best, you come to Duke Spine. Now, we talked about the fact this surgery does not do collateral damage to your body because Let me see. Let me see. Is that it? Right there? That's good. Here's why our surgery does no damage to your body. Okay? I'm going to show you. You see this sponge? It's called a sponge. Okay? But it's not really a sponge. We call it a sponge. You see, it's made up of fibers, which are these long strings, but there's spaces between them. What I'm doing is I'm taking this and I'm passing it between the fibers. So I'm not actually cutting anything. You see that? Henry, you see that?
Yes, we do.
That's what we're doing inside. Now the only thing we're cutting is the skin. The skin has to be cut. You can't, the skin is not made of fibers. Everything below the skin is made up of fibers. So I'm passing this dilator through, all right, and it's spreading the fibers, but look what happens when I'm done. The fibers are going to go back to their normal configuration. So this surgery you're watching is the only spine surgery in the world where you're not actually cutting muscle, cutting fascia, cutting bone, cutting ligaments. That's why these patients recover in 1 hour and go home. That's why these patients don't take narcotic painkillers after our surgery. They take Tylenol because we're not doing any damage inside. Also, there's no bleeding, and people can go back to work with some restrictions the next day. It's an amazing surgery. We're trying to get the word out. Unfortunately, of course, hospitals and other spine surgeons who don't do this surgery, they don't recommend it, they don't promote it, so we're the only ones talking about it because we're the ones doing it. Also, companies that sell screws and rods, they don't want you knowing about this surgery because they want you to get their screws and rods. All right, here's the disc, there's the tear, and you see that pink stuff there? That is the inflammation that the video showed you earlier. Now, Henry, you haven't shown our Duke laser disc repair video, right?
No, we have not.
Let's go ahead and show it because I want to show the audience what we're doing with this laser.
Of course.
How we're removing the inflammatory tissue, the herniation. We call it an annular debridement. It's the first of its kind, and it was pioneered by myself, Dr. Duke Machen. And it'll be the treatment of the future that everybody in the world will get for back pain is this exact treatment that I pioneered. All right, go ahead.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Yeah, we're just talking about the older generations. My grandmother is Irish, British, lived in New York, grew up in New York. Her parents came over from Ireland and England, and she was Irish, British, and she was a tough old lady, a tough old snapper. And we were just talking about anytime us kids were not behaving perfectly, there was she would always say to us, "Hey, look, Sonny, you're cruising for a bruising." Huh? Yeah. And she didn't have to say anything more than that. That was it, you know. Just that stern look and that Irish blood. My grandfather, on my mom's side, on the other hand, he was Dutch and German, and he never raised his voice or said anything of disciplinary types, ever. No, he left it for his wife. His wife did it all. He was more didn't really, you know, I guess a lot of the disciplining was left to the mother or grandmother. So anyway, if you have questions, feel free to type them up. We just showed you the video on the Duke laser disc repair. So what are we doing here, folks? We are inside the tear in the wall of the disc where the herniation has come out. That's the blue stuff. And I'm using my laser to remove the herniation, but also remove the scar tissue inside this tear so that it will heal. And I'm removing herniation, scar tissue, and the pink stuff earlier. Can you guess what that was? That wasn't blood. It's called inflammatory tissue. And that's what causes all the pain, is that inflammatory tissue. Just like a pimple. Here's the herniation, by the way. Here it comes. Bam. Let's take a look at this herniation, Henry.
Of course.
You guys see it?
Yes,
There is a piece of herniation right there. And it's staining blue because it's degenerated, okay? And I just grabbed it out. It's about 1 centimeter by 1 centimeter. Okay? But there's more work to be done because it's not just about the herniation. It's really about the inflammation. And it's about getting this tear to feel better by getting rid of inflammation. To do that, we got to debride it. So we're doing the annular debridement, which is removing the inflammatory tissue. So if you were to say, well, Dr. Duke, you just took out the herniation, aren't you done? No. Most surgeons would be done. That's called a herniectomy. But what we have to do to get rid of the back pain is do the annular debridement, which is what I'm doing right now. You see some more inflammatory tissue there in the corner. Any questions?
Yes, we have a question coming from Faisal on Facebook
All right. Good morning, Faisal.
saying, "Hi, doctor.
Hi there.
Can your surgery ever get done via a local anesthetic, not general anesthesia, or local anesthesia, not general anesthesia?"
Careful, you're going to make Dr. Berndes scared. Very nervous. So, can this surgery ever be done with local? That's a very good question. And the answer is no. No, it cannot, for many reasons. One is patient comfort. Patients need to be asleep. It's too long of a procedure. It's too painful. And local will not work, period. This tissue I'm cleaning right now with the laser is so painful that if this patient was awake, they would literally be coming off the operating table and falling on the floor. And we're not going to let that happen, okay? It's too painful. I mean, these people come here because this right here hurts so bad they can't live a normal life, right? They stop exercising, they stop doing hobbies and golfing. They're in so much pain when they aggravate this area that they can't even live a normal life. Many of them do alcohol, drugs, even commit suicide from this kind of pain. So I'm going to be sticking my probe in here and using a laser. It is literally the most painful thing you have ever experienced in your life. So we need to put the brain asleep, and we need the brain to be dissociated from the pain. Emotionally, psychologically, physically, we don't want movement. We don't want the patient remembering this. They need anesthesia. All right, we're just about done with this one. This is 2-3, right?
Yes.
Yeah, I was thinking about not doing this one, but oh no, it needed to be done. I was looking at the MRI going, just verifying that we need to do everything that we're doing, because I like to do that every day. I always double and triple and quadruple check my patient's surgery that I'm doing to make sure that I'm doing everything right, that we're planning everything right. And when I was looking at his MRI, I was looking at this particular disc, and I thought, doesn't look that bad on the MRI. It looks pretty good. But now that I'm here, my God, it's terrible. And the other day when we did 2-3, he had 10 out of 10 pain. So I know this is a painful disc. Any more questions?
At this moment, no current questions.
So folks, this laser you're watching that's cleaning up this herniation right here, it's stuck inside the tear, this is called the Duke Laser Disc Repair. And Duke Spine Institute pioneered this treatment. We're the first in the world to do it, the first to publish it, the first to teach it. I actually am the one who pioneered it. And I want you to know that that fiber right there, that laser fiber, is glass. That is a 1 millimeter wide fiber, 1 millimeter. So when I zap away the tissue that you guys are seeing, the herniation right here, the blue stuff, and the scar tissue and all this stuff, I'm getting rid of it. I could get rid of it at literally 1/20th. If you took that millimeter and cut it into 20 pieces, like lengthwise, 1/20th is the sensitivity or specificity or accuracy or precision of the treatment. 1/20th of a millimeter. Now, in all of medicine, there is no other treatment that exists that is more precise, more accurate than this surgery you're watching right now. Okay? Even with a gamma knife. Gamma knife precision is close to what we are, but it's not at 0.05 millimeter. Gamma knife is around 0.5 millimeter, half a millimeter, but this is 0.05. This is 10 times more precise than a gamma knife. And the gamma knife is a very precise tool, okay, for treating tumors. Now this disc herniation is a tumor. This is a tumor, okay? In medicine, tumors are masses of tissue. In other words, bulging masses of tissue, which this is. And there's a tear. So we're treating a tumor. It's not cancer, it's just a tumor. And we're treating it with the laser endoscopically. And this is the most precise treatment available in all of medicine, okay? There's nothing more precise than this. So when you hear surgeons talking about the laser procedure on the spine and they're criticizing it, that just means they don't know what they're talking about. They have no experience doing this. But I've been doing this surgery for almost 20 years now. And in 20 years of doing this surgery, I do every other kind of surgery. I've done it. So I know how to do radiosurgery. I know how to do endovascular surgery. I know how to do open and minimally invasive and complex spine surgery and brain surgery, pediatric brain surgery. I do everything. I've done it all as a neurosurgeon in training, okay? And there's no treatment that is as precise as this treatment right here. I can peel a herniation off the spinal cord in the neck with 0.05 millimeter of accuracy using this laser and the endoscope. So please don't believe those articles out there where those doctors are basically lying in order to keep their business. They don't want to lose their business to the endoscopic laser surgeons. All right, look at all this scar tissue here. It's amazing how much scar tissue. All this white stuff is scar tissue. That comes from chronic inflammation, meaning he injured his disc. There was a herniation, which we've been taking out, the blue stuff, and the herniation caused all this scar tissue to form. Okay, that is the outside of the disc. We're just about at the epidural space. This is going to be the most painful part of the surgery for him, at least of this disc. I got 2 minutes left on this disc, 2 minutes. Now, I will tell you, when he came in this morning, he was complaining of a sharp pain in his buttock, left buttock. And I diagnosed him with what's called piriformis syndrome. And we're going to be treating the piriformis syndrome too. He wants us to treat it. All right. Now, his insurance company won't be happy about it, but as a doctor, my job is to do what's best for the patient, not the insurance company. And, you know, fixing the piriformis problem today is really what's best for the patient. So I don't want to leave the patient in pain. Just there's the end of the disc and the fat in the epidural space. And this whole thing was pinching the nerve root that was exiting here, which is L2. Any questions? You guys are starting to see some of the crisscross fibers of the annulus.
At this moment, no current questions. So in the meantime, why don't we show the audience, as you just mentioned, the piriformis, why don't we show them
I think it's a great idea. Thank you, Henry.
Of course, of course.
All right.
piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from the animation we just showed you that there's a muscle that lives in the top of your buttock, top half. You have one on the left, one on the right. That muscle runs from the tailbone, called the sacrum, over to the top of your hip. And it's so short, this muscle. It's shorter than any other muscle attaching from the tailbone to the hip, that when you bend over improperly to pick something up, you actually tear the muscle. Once it's torn, it never heals. Never heals. We've never seen it heal on its own. In all these years of treating it, we've done shots and Botox and PRP and stem cells. We've done so many different treatments that, and every one of those treatments will help the pain for a little while, like maybe for a few weeks, but then the pain comes back. So what's better? Just keep treating it and waiting for the pain to come back, or would you want to cure it and get rid of it permanently? I know what I would want. I want a cure. I want to get rid of it permanently. So that's what we're going to do with the piriformis pain. The way you do that is it's called the piriformis release, where I go in and basically, and with a small incision, 4 millimeters, I use our plasma wand, the Duke plasma wand, to basically cut off the scar tissue associated with the inflammation, and it relaxes the muscle. It allows the muscle to heal. Once you take the tension off the muscle, it heals on its own. And that's what we want. We want that muscle to heal on its own, and that takes the pain away. So you guys see this? He's wiggling. He's not awake. He's just responding to the pain where we are. Because look, show us, Jordan. Show us where the tip of the dilator is. See that, guys? The tip of that dilator is touching the herniation and the tear. And by touching the tear, the painful tear, it's literally waking him up. So we're giving him some more medicine to put him to sleep. The point is, that's how painful those tears are. You just touch it lightly, and the pain is excruciating. Yeah, he's still wiggling. So I'm just going to wait a minute until we get him under better control with his pain. Give my anesthesiologist, and yeah, he's a big guy. He's like a football player. He's big, so he takes a lot of medicine. Any questions?
At this moment, no current questions.
Well, in that case, let's show the audience one more time the 30 causes of back pain, because I'll talk about them next.
Of course.
I'm Dr. Ardig Majin with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. So we're working on the L3-4 disc tear, the herniation and tear. This is called an annular debridement. We're doing it with the laser endoscopic. You just watched our animation, and we call that the 30 causes of chronic back pain. Why is that? Because there are 30 causes of back pain. And we're talking about chronic back pain, which is back pain that you either have on and off for 6 weeks or more, or that stays there in your back for more than 6 weeks constantly. So it's either constant or intermittent back pain lasting more than 6 weeks. That's what we call chronic back pain. And it turns out that the most common cause of chronic back pain is a damaged disc. Specifically, it is a tear in the back of your disc called the annular tear. And because it's in the back of the disc, it's called the posterior annular tear. And the tear by itself is not what causes back pain, but it's inflammation happening inside the tear that causes that pain. So what percentage of patients with chronic back pain have pain coming from the disc as the primary source? Primary source is the main source of their back pain. The answer is 85%. So disc injuries account for 85% of chronic back pain. Disc injuries. And how do you get a disc injury? Well, you can get a disc injury playing sports like football, rugby, soccer. You can get a disc injury. And by the way, when I say football, rugby, soccer, those aren't the only sports. There's other sports you can get disc injuries. Golf is another one because of the velocity of the swing for the drive, or even hitting the ball, chipping the ball. But basically, you can get disc injuries through sports. You can get disc injuries through car accidents. You can get disc injuries through industrial work-related injuries, like lifting something heavy or something falling on you, falling out of a tree, so a slip and fall or a fall. Those are all have one thing in common. The answer of what's in common is that they have trauma to the spine. So basically, disc injuries require trauma, a traumatic injury to the spine. That's how you get the annular tear. Once you have the annular tear, the nuclear material or jelly that's in the center of your disc starts to come out through the tear. And when enough of it gets out and gets stuck inside the tear, it creates an inflammatory response. Your body sees that herniation trying to escape, and your body's inflammatory system attacks it. Where did all this information come from? Well, it was discovered by me about 20 years ago, and I described it 20 years ago, that the herniation trying to escape from the annular tear in the back of the disc is the cause of back pain. We've even published our procedure and what it's designed to treat, which is discogenic back pain, which happens, by the way, with different types of disc injuries. So why are there so many different names out there for disc injuries? You hear slip disc, bulging disc, ruptured disc, protruded disc, extruded disc, herniated disc, degenerated disc, spondylitic disc. All those names refer to the same thing, which is a disc injury. So I prefer to use the term disc injury because any of those disc injuries, bulging disc, slip disc, ruptured disc, protruded disc, extruded disc, degenerated disc, spondylitic disc, herniated disc, all of them really are herniated discs that eventually over time become degenerated. So you get a degenerated disc from the herniation and the ensuing inflammation, which is your body trying to repair the tear and get rid of the herniation, but not able to. These are all pieces of herniation right here. You're seeing these little things that I'm zapping with the laser right now. Those are pieces of herniation. And you can see they're embedded within the annular tear. There's the annulus, and these little pieces of herniation are on their way out. They're leaving the center of the disc and going to the epidural space where the nerves are. So, what's the evolutionary advantage of human beings or animals having pain, back pain, with a herniated disc? It's actually quite fascinating. I've thought about it, and I understand it now. The evolutionary advantage is that when you have a herniated disc, if it gets too herniated, too much, you actually crush the nerve or the spinal cord and you lose function in your leg. You basically become paralyzed in your leg. So wouldn't you like to know before you lose function in your leg and you become paralyzed? Like thousands of years ago, human beings had to run around everywhere and hunt for their own food, and avoid predators. They had to run and hide. And it's really hard to avoid predators. It's really hard to hunt and capture food when you can't run because you have a drop foot, right? Makes sense. So the pain that comes from a disc herniation in the back of the disc is a warning to the human to slow down, take it easy, and don't do too much physical activity. Otherwise, you're going to make more herniation and you're going to have a drop foot. You're going to lose function. Then you're going to be eaten by a lion. Makes sense, doesn't it? So when you look at most things in life that have evolved over time, their structure is as such that it creates a certain function. In other words, structure and function are two principles that are interrelated deeply through evolution, and there is an evolutionary advantage to certain structural features over others. So having back pain when you have a disc herniation to prevent the human from doing too much physical activity is actually a good evolutionary advantage. And it warns the person they're about to lose function in their leg and become weak, unable to run away from predators. Okay? So that's the evolutionary advantage of having back pain from a herniated disc. Now, for thousands of years, humans have not been able to cure this pain until now. And I discovered the first cure, which is the Duke laser disc repair procedure you're watching right now. The discs are the cause of back pain in 85% of patients. Now, in 10% of patients, it's not the disc causing back pain that's the primary cause. It's actually the facet joints. And facet joints are another type of joint located in the back, which the facet joints get injured at the same time the disc gets injured. So the kind of trauma to the spine needed to make a disc injury is the same trauma needed to make a facet injury, and it happens at the same time. You see, discs and facets move together. You can't move one and not the other. They move in unison, okay, because they're connected to the same bone. And bones are stiff. Bones are rigid. So when two bones move with respect to each other, the adjacent bones, adjacent vertebrae move, they're going to move at the disc and they're going to move at the facet. So when you move suddenly and violently and injure a disc, you're going to move suddenly and violently and injure the facets. But the facet joints are not the primary cause of pain most of the time. The disc is. And it makes sense, right? After all, the disc is the one that can damage your nerve root, which causes weakness and loss of function, causes you to hobble instead of run. So evolutionarily, disc pain is more important than facet pain in terms of altering human behavior and providing a advantage survival-wise, which is very Darwinian, right? All of the favorable evolutionary changes that occur to animals that give a benefit to them to survive and procreate, those types of changes are the ones that are selected for over time. So people that have a herniated disc and have back pain, believe it or not, that's an evolutionary advantage. From millions of years of evolution, it's an advantage, and it confers an advantage to the individual that has back pain. But in today's society, we don't need to live with back pain anymore, and we have a lot more injuries to our spines, right? We have car accidents, and they didn't have cars a million years ago. We just ran around and did things with our legs, maybe a chariot. But literally for millions of years of evolution, humans didn't have chariots, they didn't have horses, they didn't have cars. We had our legs. So it was very hard to actually hurt your disc living on Earth as a human for millions of years. So disc injuries are really more common now because of our modern society with bicycles and horses and cars, and basically high velocity injuries to the spine. So disc injuries are a common sequela of high velocity injuries to the spine, which is something that happens in modern day living, right? In cities, metropolitan cities, people with the means to have a car or bicycle or motorcycle, play sports. So what I'm getting at is disc injuries and disc pain is more of a newer thing in the last couple hundred years, whereas it really didn't bother humans too much thousands of years ago or millions of years ago. Anyway, the third most common cause of back pain is the piriformis muscle, and we're going to be fixing his. And finally, the fourth most common cause of back pain is the sacroiliac joint. Now, how do we get all this data? We got this data by looking at 5,000 of our own patients with chronic back pain. And this research was done by Arias Dugmajan, my son, who's now at Princeton, finishing his second year. He is pre-med, studying organic chemistry this year, and Korean, and a variety of other, like biology. So hopefully he's going to end up taking over Duke Spine and taking care of patients the same way I have. But there you have it. Disc, facet, SI, piriformis, 99% of back pain. Fractures of the vertebral body, 0.5%. So 99.5% of all chronic back pain is totally curable now at Duke Spine Institute, nowhere else in the world. And if you want to get fixed, you got to come here and get it done. We'll do it the right way. Any questions?
No current questions, so we do have a couple comments coming. This first one coming from Mary on Facebook.
Yep.
Saying, I miss Dr. Duke. My lawyer said, no Florida for me. I don't have that kind of money in the bank. I need surgery or two on my back.
So sorry to hear. But Mary, I'm not sure what your lawyer is telling you, but I don't know your situation in details. But a lot of times lawyers will tell you no, even though the answer could be yes. I don't know your situation. I don't want to guess. But if you have an accident and somebody owes you money, unfortunately, a lot of personal injury lawyers will lie to their clients, tell them there's no way to get the money to pay for your surgery when there actually is. It's called borrowing money against your case. And there are companies that loan money to people who are injured in accidents so that they can get the medical care they need right away and not suffer. So your lawyer may not have told you about that, may have told you about it. I don't know the case, but you should discuss it with your attorney. If it turns out that there's enough money available in the policy of the person that hurt you and they would cover your medical bills, then you need to seriously consider finding another lawyer who's willing to help you get the care you need. After all, if you're injured in an accident, what's more important? Money in the bank from the settlement or your health? Sam said, changing irrigation. That's her answer. Point is, your health is more important. In life, your health is more important. I will tell you that. I know that with absolute certainty. If I had to choose between suffering the rest of my life and having some money in the bank, I would choose to get fixed if that opportunity existed. I would not want to suffer. Suffering does horrible things to people. It changes their psychology. It changes their personality. It causes people to do things like do drugs and alcohol, which then become addicting and cause people to die. So this one I got 1 minute. We're almost done. I'm just trying to tease out the last few pieces here. All right, but thank you for sharing that. I strongly recommend you consider another attorney who can get you the surgery done by borrowing the money. All right, we're done here, I think. Let me just take a peek. Yeah, that looks good. Let me just get that last little bit. Any other comments or questions?
We have a comment coming from Shannon on YouTube
Shannon on YouTube. All right.
saying, or I think it's a question, do you have Gmail? I could send my question there, please. Shannon from Michigan. And I responded, you can ask the question here if you like. So Dr. Duke is willing to answer, but no response then, no worries. It's all good.
Yeah. Unfortunately, I don't share my Gmail with anybody. If you want your question answered privately, set up a private meeting with me. It's called a free MRI review. We offer it to everybody. It's free, as it says, free MRI review. You just have to provide us with your MRI images and the report, and we'll set up a Zoom call, and you can ask away all the questions you want privately. Just you and me and my team.
Other than that, no current questions.
All right, we're just about done with this number 2, and then we're going to move on to number 3. 3 out of 4. You can see the defect there from the tear. It's pretty big. That's remember, the inside of this tube is 5.5 millimeters, so that defect is probably at least 3 or 4 millimeters, probably 4 millimeters wide. So we see at the end of these annular debridements, sometimes the tear that's left is just 1 or 2 millimeters, sometimes it's more. There's no suction for some reason, I'm not sure why. Scope off. Still no suction. Any other questions?
At this moment, no current questions.
All right. No, don't push it in. I got it. Come on in, Jordan. What is it? Since there's no questions, why don't we show our audience one more time how the disc injury causes back pain that doesn't go away on its own, requires the Duke laser disc repair surgery. And after that, we'll show them the facets, the SI, and the piriformis. Shot?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349 6922.
All right, welcome back. You can see that the annular tear gets the herniation, causes the back pain. That's what we're here to fix. There's some more inflammatory tissue. You guys see the red? That
Yes, we
pinkish
do.
stuff, that is where the back pain comes from. We're gonna zap that away with a laser. This is number 4-5 disc, right? And we got one more left after this. Not as much herniation here, more tear than herniation, but there are some small pieces, the blue stuff you're seeing. And any questions? We're gonna, if you have no questions, we'll just go on to the facet pain one more time, and then we'll finish it off with SI and piriformis.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Folks, there it is. Look at that beautifulness right there. That pink tissue should not be there. That is 100% not supposed to be there. That is the culprit. That is living right inside the tear in the back of the disc. It is inflammatory tissue. It has little nerve fibers called type 4 fibers or C fibers, and they transmit pain signals up to the brain. That is your nest of pain right there. That's like a hornet's nest. And now we're saying goodbye. Wave your hand goodbye. Nikki, I want a hand waving goodbye, please. Adios, amigos. Adios, muchachos. All right, we have a question, I heard.
Yes, we have a question coming from Pavel on YouTube
Hi, Pavel.
saying, "Hi, Dr. Duke. What scan can show that piriformis muscle tear before release is performed?"
There is no scan. You can do an ultrasound. Some people do diagnostic block where they inject some medicine called numbing medicine into the muscle using ultrasound, or x-ray. We're using a myogram where you inject dye into the muscle, look for the tear. But there is no test that confirms the piriformis is the cause of the pain. It has to be done clinically by somebody like me with many years of experience treating it, who can make the right diagnosis for you and fix it for you. So Duke Spine Institute is the diagnosis, scan, and the cure. Just remember that. Unfortunately, the questions you guys are asking me are great questions, but nobody else knows this stuff, right? If you talk to most pain management doctors, they don't know how to diagnose piriformis. If you talk to spine surgeons, they don't know how to diagnose it. There's only a few doctors in the world that know how to treat, diagnose, and treat piriformis syndrome. There's just a few, not many. And you really have to become an expert on it, like I have. So we have not just figured out how to diagnose it clinically on examination without scans. but we also learned how to fix it so that it goes away permanently for you. And that's really, really difficult to find a place that does both diagnosis and the fix. But Duke Spine Institute is that place. So if you've got piriformis syndrome or you want to know, do I have it? Do a Zoom call with me, and Henry will put the link in the chat box. You just got to do a Zoom call, and I will tell you if you have piriformis syndrome. In literally a minute, the first minute of the call, I will tell you whether or not you have piriformis syndrome. All right, great questions.
And at this moment, no current questions.
Yeah, it's a clinical diagnosis. It's not a scan. The scan will not tell you. Just like the MRI will not tell you where your back pain is coming from, there is no scan, there is no test that tells you. It is experience. You need somebody with experience, like me. All right, I think we're done here. What a difference that one is, huh? Compared to the last one, we're already done. The other one took a lot longer at L3-4. And look at the tear right there, it's tiny. Like if you were to measure the tear compared to the 1 millimeter wide laser fiber, you're talking about maybe a 2 millimeter tear. The last one was 4, so it was twice as wide. This tear will heal faster. I like the fast ones. Huh? I wonder if we can see the nerve root somewhere over there. No, it's buried in fat. Any other questions?
At this moment, no current questions.
So we're going to finish the last disc here, 5-1, and then we're going to do his piriformis release, which is on the left side, but we'll do it as a separate stream.
Remember, this is the sensitive one.
I think I told you guys a story of Dr. Pat Jacob, who was one of my attendings at University of Florida in Gainesville when I did neurosurgery. He was universally hated by every resident because he was just it wasn't even that he was an asshole. It was that he didn't care at all about the patients. That was my interpretation, and many others. He didn't care. I watched him kill somebody that came in with a bleed. A subdural bleed, easy to remove, totally could have saved their life. He just got in there and just started sucking their brain away and then hit the middle cerebral artery and ripped it. They're toast. Just careless, just didn't give a shit. Just an asshole. And anyway, one of the residents who hated him so much, during surgery with him, was squirting water on his foot the whole surgery, and he had brand new sneakers on, and like that was the resident's claim to fame, was that he destroyed Dr. Jacob's sneakers.
How are your sneakers right now?
Mine are okay, but see, I do.
That's why you brought it up.
No, I do endoscopic surgery. We have to have a lot of water.
Right.
You're gonna get your sneakers wet. But what Jacob was doing was not endoscopic surgery. He was doing open. And the guy was...
You were using water anyway.
No, it's not me. I didn't do it. But,
I thought in general the surgery was requiring water.
well, no, it's irrigation. You're irrigating to get rid of the blood. So it was an open surgery where he was irrigating, but he was... I think they were under the scope, so maybe it was a microdiscectomy. But they were... he was squirting water on Jacob's shoes while he was under the scope, so he couldn't see what he was doing.
You didn't see where the water was coming from.
Right. And he thought it was just runoff, but it wasn't runoff. It was the resident who hates him squirting water on his shoes. Anyway, his name was Joe Stachniak. I remember his name.
How was Joe doing now?
Funny you ask. Joe is not Joe anymore. Joe is Josephine. Last I heard. Hold on, let me just check. Let's get an AP, just a quick AP. That looks pretty good.
When I was wet and wetter than wet.
Yeah. Yeah. No, I think, let me just see. Shot? Yeah. All right, we're in, like Flynn.
So Joe was highly regarded after that, almost legendary.
Yeah, he was legendary.
Right.
We had a resident room where we hung out, during the day, and he would go in and tell his stories. Anyway, I mean, we had some legendary a-holes attendings, and I think they were just very miserable, unhappy people. Neurosurgery.
Happier in private practice?
Well,
Just out of curiosity.
Jacob was in private practice. Then he failed in private practice and came to become a faculty. Yeah. There's an old saying, when you can't do, you teach, right? So he left private practice to become an academic neurosurgeon. And even then he couldn't teach. He never taught, never. He just got in there and used the residents as an assistant, but never actually did any teaching. Like I did more teaching in this surgery to you guys, talking to you about everything. I did more teaching in this surgery than he did in 7 years of teaching. You understand?
Spine surgery?
Yeah, he was a spine surgeon. But he had to take brain call, right? So when a patient came in with a bleed in their brain, a stroke, and they needed neurosurgical evacuation, or an aneurysm that had to be clipped, or something that you couldn't just wait overnight for the vascular guys to get in, he would take him to surgery. And it wasn't that he was incompetent, he just didn't care. That was the problem. He didn't care. It's shocking. I'll never forget that surgery. I'll never forget that surgery. Not how I practice medicine. That's when I knew there were differences between doctors. And you could be the best at what you do. You could be highly trained, highly competent, but if you didn't care about the patient, they could die in your care, even though you're a great surgeon, right? And I guess that makes them not a great surgeon, even though technically you're gifted. You could put screws in and take out the lamina perfectly. If you don't care about people, you're not going to be a good doctor.
We had a student when I was in med school who really didn't care about the patients either.
Yeah,
He had a critically ill patient. He asked a lot of questions.
it's all right.
He wasn't prepared for his patient and the questions. And they asked him about the distal, shot. And he goes, I don't know. Why don't you tell us? You invented it.
He said that.
We never saw that student again.
Yeah, well, that's the right way to get rid of them.
He was never seen again, never talked to again.
Good.
Gone. L2
Yeah.
hernia. My mouth was open. Thank God I had a mask on. I was shocked.
We're done. We're done. Yeah. Henry, we're done. If there's no questions, I'm going to take the piriformis next. But if there's no questions, we'll end the stream.
Copy that.
I just want to show everybody, but for those who joined late, this patient had herniated discs at L2-3, L3-4, L4-5, L5-S1 on both sides. He had a significant injury to his back. He's a big guy, so a lot of force. And he just ripped those annuluses and herniated. And by the way, if you're a big guy with a lot of mass, right? There's an old saying, force equals mass times acceleration, which basically means that the force his disc experienced equals mass times acceleration. And if you got more mass, you're going to have a greater force on those discs. So he's got a big mass, and he basically tore those discs good, and they herniated over the years, and that's why he's here. But you can see the entire surgery was done through a 8mm incision. We fixed 4 discs. If he didn't come to Duke Spine, he would have an open surgery from here to here with a scar this big, and he would be suffering in pain for months with narcotics. But instead, he got the Duke laser disc repair, and he's going to go home today in an hour. So we're going to do his piriformis next. We're going to end the stream. We'll be back for his piriformis. Any questions?
At this moment, no current questions.
Thanks for joining us. Have a nice day.